Why is heel prick blood taken from babies and which diseases are screened for? There are certain congenital diseases in babies where early diagnosis is important. To diagnose these diseases while the baby is still in the newborn period and before being discharged from hospital, 10 to 15 drops of blood are taken from the heel, dripped onto filter paper, and sent to the screening center. Further investigation is carried out at the screening center for cases that test positive in order to make a definitive diagnosis. In regions where consanguineous marriages are common, certain congenital diseases are seen, and if these diseases are diagnosed and treated before any symptoms appear, the baby will not be harmed. In our country, screening for phenylketonuria has been carried out since 1994. Phenylketonuria is a disorder of protein metabolism and is more frequently seen in cases of consanguineous marriage. If this disease is present and left untreated, it can lead to intellectual disability in the baby. In our country, its incidence is 1 in every 4,000 live births. The treatment for this disease, which causes intellectual disability if left untreated, is dietary therapy, and the earlier it is started, the more promising the results. Another disease screened for, apart from this, is congenital hypothyroidism. Most babies with congenital hypothyroidism do not show symptoms at birth. If symptoms do appear, significant intellectual disabilities may develop in the baby. Other signs of congenital hypothyroidism can include constipation, prolonged jaundice, and umbilical hernia. In our country, its incidence is 1 in every 2,200 live births. Congenital hypothyroidism can be treated with thyroid tablets. Another condition that is screened for is biotinidase deficiency. Biotin is a B vitamin, and in biotinidase deficiency, vision problems, hearing problems, hair loss, or seizures may occur. Treatment requires regular use of biotin. The response to treatment is better the earlier it is started. Cystic fibrosis was also added to our country's screening programs in 2015. In cystic fibrosis, a number of problems such as recurrent infections and growth and developmental delay are seen. It is known that early diagnosis of this disease reduces mortality rates and results in better lung function in patients. For this reason, it has been included in the screening program. Cystic fibrosis occurs in 1 out of every 2,500 live births. If the blood test is positive, a definitive diagnosis is made with a sweat test. In 2017, congenital adrenal hyperplasia was also added to the screening program as a pilot, and screenings were started in 22 of our provinces. A deficiency of cortisol in the body leads to low blood sugar, low blood pressure, salt loss in some cases, and even death. In female infants, developmental problems in the genital organs are particularly noticeable. Therefore, when this deficiency is detected, patients are supported with appropriate hormone treatments. For each disease in the screening programs, there is a separate scientific committee. Thanks to these screening programs, the death and disability of 4,500 children each year in our country is prevented.